Finland, known as the world's happiest country, is hosting the second annual Radical Health Festival in Helsinki. This 3 day event gathers health experts and policymakers to focus on the future of health and care. Gareth Presch, MHTN partner and CEO of the World Health Innovation Summit, is at the festival. Gareth, welcome.
Hi, Patricia. It's a pleasure to be here. I'm streaming live from Helsinki, so it's great to join you.
Yeah, lucky you. Tell us about the festival and what brought you there.
Well, the Finnish government, will be one of the leading healthcare, shall we say, innovators in the world, and they've taken on this initiative. They're very much at the forefront of looking at new models of healthcare. So I was invited by the health ministry to come across and speak about, the World Health Innovation Summit, the work we've been doing, the work we're doing with yourselves around mental health promotion, and because as the health system is under so much pressure at the moment. So the Radical Health Festival is looking for radical ideas. I had a keynote last night with the health ministry, and also a member of the Bavarian Ministry of Health was here as well, the lead. So there is a real shift in healthcare, and I suppose this Radical Health Festival is looking at that model.
Hmm. So tell us, what are some of the radical ideas you've heard?
Well, I suppose, if you look at mental health and, sort of new models, I was speaking last night about, how we can transition from managing disease, which is the current health system, which is a sick care model, to a preventative model. So the work that the Mental Health TV network are doing, for example, that communication, that wider audience, how do we bring the general public into this conversation? How do we, 90 odd percent of healthcare is actually in the community. So we need to look at how could we engage to reduce our costs, because as we spoke before, the health system is under immense pressure, and that applies to Finland. They're under pressure as well. So what we're looking at is sort of new models, and they're radical ideas, and that's sort of what's been pitched here.
Can you tell us more about these new models?
Yeah, absolutely. I mean, the new models are basically looking at preventing, shall we say, mental health challenges in schools. So, I've been talking about with kids here. A lot of it is very data driven. So we're looking at AI, artificial intelligence. Finland will be a pioneer in this space. They collate a lot of data from a lot of sources. So we've been hearing over the last few days about how, digital technologies can transform the delivery of healthcare. So healthcare in the home, that's been one of the key topics that we've been discussing here today. And so we're looking at this sort of transformation where, at the current present time, we have healthcare delivered in a hospital, or, what we're looking at is that transition to a hospital at home almost. You'll be able to be treated in your front room, and that's what's coming. That's the future. We've been looking at digital twins, personalized care, precision medicine. How do you actually do diagnostics at home? That's sort of like the future of healthcare, Patricia. So it's very radical, it's very transformational, it's very exciting. The key then, of course, is how do you bring and bridge investments? And that's sort of another area that we've been discussing.
Hmm. The personalized care, the diagnostics at home. Are we going to see this in the mental health space as well?
Absolutely. I think this is what you guys are pioneering. This is what excites me about our partnership working with Mental Health TV Network. I had a meeting with the ministry on Monday, and I was explaining to them the work that Mental Health TV Network were doing, and sort of that communications. And that's vital, because if you look at the situation that we face, and this is all across the world, we see spikes in mental health prevalence, and we're really only scratching the surface. So we need to ensure that we can give people the tools to manage their health and well-being at home, and that's very much focused on mental health and well-being. Just today, I was speaking with Red January, which is an initiative in the UK, which is about walk and talk. That's a new mental health initiative that they've launched, and of course, we're partnering with them with Red January, and that's part of our ecosystem. So it is very exciting. Mental health is absolutely at the forefront of these discussions.
Yeah, I mean, mental health has been called the defining health crisis of our time. So, do you think that what's being discussed here at the festival is going to impact like global health policy?
Absolutely. I think what you're seeing now is a real appetite from governments and also industry and the community to make a transition to sort of tackle these and address these issues at head on, shall we say. We really do see a shift coming down the line. It's quite encouraging. I mean, the health system is under immense pressure at the moment, but this brings opportunity. So if you take mental health, for example, can we start to implement programs in schools that alleviate this pressure further down the line? Because, a lot of children at the moment are self-harming, and we still have the fallout from COVID. People are struggling to get GP physician appointments. These are all issues that have to be addressed. And I think what we're trying to do here at the Radical Health Festival is firstly highlight an advocacy for change and then show best practice so that we can deliver these new programs that actually improve people's health and well-being. And by giving people the tools to manage their own health and well-being, we'll be able to deliver health for all.
That certainly would be something if we could do that. What do you think is the most inspiring thing that you've learned there so far?
Well, actually, I spoke to a number of patients today. I was very inspired. There are significant challenges. One of the things that I was quite frustrated about, Patricia, was the lack of investment into women's health. So that actually, it was a surprise. 2% of financing is going into women's health and women's founders. So we need to shift that one. Um, that actually is a bit of an inspiration for me because it was one of the issues I raised as a thing we need to address. So that actually has inspired me to do something about it.
Oh, wow. What do you think you're going to do?
Well, I looked at this from my two young girls' perspective, and I just thought that this just can't. We need to do something about this. We have to, how do we speak to investors and how do we get capital to flow into their ideas? Because, 50% of the population are women. So surely 50% of of the financing should go into women's investment. So that's certainly what I will be trying to advocate for in the future.
Ah, that's wonderful. I'm so glad you're going to be leading the charge on that. We need it. And I can't think of a better person to do it. Thank you, Gareth.
Appreciate it.